Skin cancers are nowadays one of the most common malignancies in the Caucasian population. If we talk specifically about malignant melanoma, its incidence increased in the last decade more rapidly than any other type of cancer in the United States population, and in Portugal is estimated to be responsible for about 90% of all skin cancer-related deaths. But despite this high mortality rate, the success rates of recovering from malignant melanoma are very high if detected during the early stages of its development. And that is why it is so important to raise awareness and educate the general population for this specific health problem. We believe that the patients can truly have a key role in the regular monitoring of their skin health, particularly in the evolution of their own skin moles. Patients with clinical or family history of skin cancer should consult regularly with dermatologists for physical skin examinations, usually once a year. In those appointments, the dermatologists look for the appearance of new skin moles and significant changes in the previously analyzed moles. One common technique usually used in the clinical practice to visually analyze the skin moles is called the ABCD rule, a set of 4 features that were considered highly relevant for the detection of melanoma, which stands for asymmetry, the symmetry of the mole in terms of geometry, internal structures, and color distribution. Border, abrupt ending of the pigment pattern at the periphery of the mole. Color, presence of 6 colors highly relevant for the detection of melanoma. Differential structures, the occurrence of specific inner structures like streaks and dots. Between the appointments, the patient is usually advised to look regularly to specific skin moles selected by the doctor. By the time the doctor looked at these skin moles, they were benign, but the selected moles typically have some characteristics that indicates they might potentially evolve to something suspicious over time. So how can the patients monitor regularly this evolution between appointments? Unfortunately, the average person usually doesn't have enough dermatological knowledge to do this kind of risk assessment to their skin moles. So we developed a mobile application that allows the patient to take a photo with a smartphone to the selected skin mole and send it to the server for analysis. In the server side, we developed an image processing module with algorithms that extracts and quantifies each one of these ABCD features for the submitted images. The classification of each feature is made separately and based on a training dataset of images manually classified by dermatology specialists. When the automatic analysis concludes, the doctor receives and validates the analysis report using the Melanoma Detection web interface. If it proves that something is in fact suspicious, the doctor has the option to ask the patient to anticipate the next physical appointment, which will be received and confirmed by the patient. This way, the patient can be seen earlier by the doctor and the suspicious changes treated in time. The melanoma detection solution was not envisioned to be a diagnostic tool or a substitute for regular appointments with dermatologists. It's intended to be a patient-oriented solution which also involves the doctor, with the intention of educate and raise the patient's awareness, provide automated assessments of skin moles, and ultimately improve the relationship between patients and dermatologists.